started right now. We're going to proceed in the order of the ones that are listed on page 2 of the memo. So our first presentation will be from the Victims Services Advisory Board. Is April Marone here? Please come forward. Ladies and gentlemen, we've tried different formats for this early morning meeting. I was going to call it a breakfast meeting, but we can't call it that anymore. We used to serve a full breakfast in the Rockville Library conference room, and that room just wasn't big enough. And generally, we wanted to give people the option of getting coffee beforehand, but for a lot of folks, showing up at 8:30 was easier than showing up at 8 o'clock, and serving a full breakfast seemed like a chore. A lot of people didn't show up for it. There were a lot of commission representatives and staff who wanted to attend, so finding a room that was big enough became a challenge. So here we are in the great big council hearing room, and here Mr. Rice and I are sitting up at this big podium glaring down at participants, but I hope you won't be intimidated by our presence at the dais. We're here to have a very informal conversation, although we are going to implement, and this is to help you focus your presentation, the practice that we employ at public hearings. That is, a light will go on after 3 minutes. We're not going to be as rigid as we are at public hearings, but it is to help you focus your thinking and hit the main points. We have the written description of your board or your commission's highlights and priorities here in the packet, so you don't need to read the whole thing. I would try to, for everybody's benefit, hit the main points and conclude within 3 minutes. So please introduce yourself on behalf of the Victim Services Advisory Board. And you need to press the button at the base of your microphone.
My name is April Marone, and I'm a co-chair with the Victim Services Advisory Board.
Okay. Robin Stimson, co-chair for the Victim Services Advocacy Board.
Thank you for being here.
Thank you.
So we have also developed a joint statement for the HHS BCCs. May I read that first and then do the Victim Services Advisory Board statement?
Yes, I'm sorry. Explain again. A joint statement of who?
Of the Health and Human Services Boards, Committees, and Commissions.
Oh, okay.
Okay. Okay, so Montgomery County's Department of Health and Human Services, HHS, is responsible for public health and human services that help address the needs of our community's most vulnerable children, adults, and seniors. HHS boards, committees, and commissions, BCCs, provide an array of diverse, caring, and knowledgeable volunteers to help the county's HHS achieve its mission. Boards and commissions identify issues and support budget and policy recommendations about important community needs. BCCs work on behalf of every member of our multicultural and multi-generational community. As evidenced by the 2013 review and evaluation, BCCs provide volunteer service at relatively low cost. This saves hundreds of county staff hours through our collective expertise, research, and analyses of data needed to advise the county executive and the county council. We communicate with HHS via quarterly meetings, through written reports, and through staff liaisons. We inform with the county executive and county council at every opportunity. HHS BCC's individual missions align with the areas through which HHS provides service: aging and disability services, behavioral health and crisis services, children, youth, and family services, public health services, and services to prevent and end homelessness. Though each individual BCC has its own mission, collectively we address issues of public importance to the entire diverse community. A few examples of cross-cutting issues are mental health, poverty, including food insecurity, affordable housing, transportation, and the opioid epidemic. No single board can address the multifaceted impacts of these issues on each population in our community. Each BCC provides a unique and valuable perspective. We all want these services across our community, and we want them to be accessible and of high quality. While the specific goals of each BCC may be different depending on the community we serve, for example, victims of domestic violence, victims of crime, older adults, children, people with disabilities, or veterans, we try to identify areas of common concern and collaborate to achieve common goals. Examples include Commission on Aging in collaboration with the Commission on People with Disabilities to ensure that the proceeds from the Transportation Services Insurance Fund are used to expand accessible taxi services throughout the county. The Victim Services Advisory Board has worked with the Interagency Commission on Homelessness to help identify ways to address the need for transitional housing for domestic violence victims. To facilitate these collaborations, BCCs liaise with other BCCs as appropriate. Any apparent overlap among BCC's mission and focus ensures that there are no gaps. The existence of these multiple BCCs within the unified structure of HHS best leverages the value proposition of an integrated care delivery system. With your county's HHS BCCs, you have teams of engaged and knowledgeable volunteer residents who augment the great work done by HHS, the county executive, and the county council on behalf of every Montgomery County resident. Thank you.
I've been chairman of the HHS committee for 16 years. I offered the authorizing legislation for at least 3, maybe more, of the boards and commissions that serve us now. Montgomery Cares Advisory Board, Interagency Commission on Homelessness, and well, those are the 2 that the legislation that I sponsored, but I've been involved in, I've been hosting these breakfasts for 16 years. The suggestion that there is overlap and redundancy is in no way to discredit the important work of highly credentialed community members who serve on these boards and commissions. But the executive and council, we serve all the people of Montgomery County. We don't serve the boards and commissions. The boards and commissions are created to advise the policymakers. So if in future a suggestion is made to restructure or reorganize boards and commissions, it is my hope that those community leaders who have volunteered to serve on the boards and commissions will be open to considering what structure is most productive and helpful for those who are supposed to be the recipients of the input, that is the executive and council. I have made comments recently about looking at further ways to restructure boards and commissions. I do think that there is a lot of staff time that goes into what staff have told me are duplicative discussions. And so I appreciate the service of everyone who's here, and I appreciate the sentiment behind this statement. But it is important that government look at ways in which its mission can be achieved most efficiently and most effectively, and I'm leaving the county council, so we'll see what the future executive and future council want to do with respect to the structuring of boards and commissions. If the sentiment in that statement is that the current structure is perfect and must never be changed in any way, I don't think that's an appropriate approach to managing the government. I don't think any structure in government is perfect, and I think government can always benefit from review from the standpoint of efficiency and effectiveness. So while I am very grateful for everybody's service, I think I'm not in complete agreement with the sentiment expressed in that statement. Can we hear from the Victim Services Advisory Board?
Absolutely. Thank you again for your time. So the Victim Services Advocacy Board dedicates time to identifying the needs of crime victims to ensure that they are being met considering our county's budget. The VSAP, or VSAB, board recognizes the importance of community and providing quality services to crime victims in need, with the focus on the idea that our county government has a responsibility to provide sufficient funding to serve crime victims. Moving forward, the VSAB will continue to provide both the county executive and the county council recommendations on how best to meet the needs of crime victims and their families in Montgomery County. We make it our mission to serve this community. Our current policy issues are as follows, and these are just our highlights. Policy issue 1, resolving housing issues for domestic violence victims and their families. Domestic violence victims are provided temporary shelter at the Betty Ann Krunke Center, BAK, which is the only shelter in the county for domestic violence victims fleeing dangerous abusers. Those unable to transition from the center to safe housing conditions are provided temporary hotel housing, which is expensive and inadequate with respect to protection from abusers. In addition, when victims cannot safely transition out of the shelter, high lethality victims are waitlisted and placed in hotels. The board recommends that the county identify transitional housing units for survivors with a beginning goal of accommodating 20 individuals and revisit a previous funding request of $100,000 for specialized domestic violence case management services to include safety planning, employment readiness, education, and other trainings. As the county has made it a policy to eradicate homelessness for the veterans in the past years with great success, we ask now that we make ending homelessness for domestic violence victims the next priority. Policy issue 2, increase funding for domestic violence offender groups. Trauma Services Abused Persons Program offers domestic violence offender groups through a contractor. These groups are ordered by the judicial system, which refer over 600 offenders annually to this mandatory program. These groups help decrease or eradicate recidivism of domestic violence offenses. In fiscal year 16 groups needed to be canceled because of lack of funding. Moreover, funding is not in place for a clinical intake person or a therapist for this program. Most DV victims want the abuse to stop and not to terminate their relationships. These groups are valuable for that goal, and the board is advocating for more funding to fill the needed gaps in service. Policy issue 3, restoration of trauma services staff to previous levels of services. There is a need for more trauma services victim assistance to staff the local circuit and district courthouses in Rockville and Silver Spring. Trauma services VAs are independent to the criminal justice system and are on the front line within our courtrooms. Over the last 5 years, the Victim Assistance Program has seen significant cuts. Thus, there are not enough VAs in the courts to meet the needs of victims. The impact of the cuts has resulted in the delay of processing compensation cases for crime victims and less court coverage in both circuit and district courts, where crime victims are seeking immediate assistance. In the last Court Watch report and independent court monitoring program, it was reported that 42% of DV victims did not have a lawyer or VA at their final protective order. The board is advocating for more funding to fill the need and gaps in VA services. And finally, policy issue number 4, we are advocating for policy change on forensic exams for rape and sexual assault victims. Thank you.
Thank you very much. I appreciate the observation regarding the necessity of prioritizing housing for domestic violence victims, and this is actually a good example of where different boards and commissions with different missions will find that they are able to share priorities and share suggestions, and we'll be hearing, I guess, from Brian Tracy later on behalf of the Interagency Commission on Homelessness. But in the broad sense, the county's next priority after veterans and chronically homeless are families, which are disproportionately, homeless families are disproportionately the victims of domestic violence. But it's a very well taken point, and the Interagency Commission on Homelessness, I hope, will take it up for discussion. Thank you very much.
Thank you.
Mr. Rice.
Thank you. I had a question about policy issue number 2, because I've been following very closely what's happening, talking with a number of advocates regarding domestic violence offender training services, things that are mandated to give them what they need to get themselves on a better track when it comes to positive relationships. And so I'm curious, because you say that there's a contractor, but then there were groups that were canceled because of lack of funding. Did we cancel a contract, or was the contract to begin with never for the full number of groups? I'm just trying to understand that process. If somebody could answer.
Sure. I mean, I can probably get back to you more specifics, but I think what the overall issue is that the demand and the number of people who need these services, the contractors we have too many people who need to attend some of these classes, I believe is what.
I can chime in.
If you're going to chime in, please come up to the microphone.
Yeah.
And press the button at the base of the microphone.
I'm the board liaison for the Victim Service Advisory Board, and the contract wasn't canceled. What happened is that there had to be a pause or delay into further funding to have the groups because the contract ran out of funding at that time.
But not anymore.
If the HHS director wants to speak, could
Yeah.
she please come to the microphone and press the button at the base of the microphone? And if you other two ladies could turn your microphone off. And I don't know your name, the board representative for the Victim Services Advisory Board.
Thank you. There you go.
Sia, yeah, okay, Ms. Alawali.
Good morning. For the record, my name is Uma Alawali. I'm the director of the Department of Health and Human Services. We did have a problem in 2016, but I don't believe the problem is as acute today, that we have, in fact, been able to find other sources of funding. I think the fact is correct that there is greater need, there's more demand for this service, but I don't believe that there's any reduction in funding today.
Okay, and so it's certainly something where I appreciate the flag. I do think it's important to understand, and so if folks could just get back to me in terms of what that mandatory training looks like, what the number of people are over the past 3 years, it'll be great to just see some of those trends and understand a little bit more about that, because I do believe, as you said, that certainly making sure that these abusers certainly get help. It's our victims who need help, most certainly, but if the abusers don't get help as well, they'll continue to abuse and continue to cause that continuous cycle in our community. So thank you. Appreciate it, Mr. Chair.
Okay, thank you very much. Let's hear from the Montgomery Cares Advisory Board. Steve Gammarino. By the way, the third board and commission that I introduced the authorizing legislation for was the Healthy Montgomery Steering Committee, which, interestingly enough, is not presenting here this morning. I'm not quite sure why.
It's not a commission board yet. It needs to be before. If I could just make one other statement. The point of the joint statement, I just wanted to clarify, was to show that the integration across health and human services also impacts positively on the existence of the boards and commissions, not so much to speak to the duplicative nature of some of the boards and commissions. So I just wanted to correct that nuanced perception. If we weren't clear enough, I apologize. The intent was for the commissioners to be able to share with you the fact that they actually work across different boards and commissions on issues, key issues, where they see crossover.
Mm-hmm. And we have many good examples of that in this.
Right. That was
again,
the
I keep
only
wanting to call this a breakfast, but we won't call it that anymore. This early morning meeting provides a great opportunity for that cross-pollination and for council members to get the benefit of it. Mr. Gammarino. You need to press the button at the base of the microphone.
Good morning. I'm going to focus my comments on our two overarching priorities. The first is reducing and eliminating barriers to access to care. This has become increasingly important as some federal laws affecting public programs are reducing access. Additionally, the political climate is affecting some of our most vulnerable residents from seeking and obtaining the necessary health care they need. Related to this, the Montgomery Cares Advisory Board has been asked to evaluate and provide recommendations to your committee related to the Montgomery Cares patients and their eligibility for other health care services, such as the QHP, Medicare, and Medicaid. This initiative will be conducted in two phases. First, in the short run, the committee will evaluate and make recommendations related to questions associated with the eligibility process itself. And second, in the mid-long term, it will evaluate and make recommendations regarding the affordability issue associated with these other health care coverages. Additionally, the board continues to focus on ensuring that core primary care services meet patient demand while expanding in two specific areas, both specialty care and immunizations for this vulnerable population. The second overarching priority involves identifying synergies and improving quality associated with the 5 programs that we have oversight on. The Montgomery Cares Advisory Board is emphasizing the need to have data and performance measures that show the effectiveness of these programs. This year, the board is focused on 3 specific areas. First, quality assurance reviews will be held on 3 of the 5 programs. They are Care for Kids, Maternity Partnership, and Montgomery Cares. These reviews will focus on process and outcomes associated with the delivery of health care. Secondly, we'll be taking a look at assessing the delivery of dental services provided to county and private clinics to ensure cost-effective quality dental dental care. As the county faces ongoing fiscal constraints, it is critical to identify the most cost-effective platform for the delivery of dental care. And third, improving the coordination of housing and health care to improve medical outcomes for the homeless. That concludes my statement.
Thank you so much. Appreciate the report. Let's hear from the Mental Health Advisory Committee. Jennifer Jones.
Yes, okay. Good morning. My name is Jennifer Jones, and I'm the chair of the Mental Health Advisory Committee. I just need to speak on behalf of the committee saying we will miss you. We've really enjoyed your encouragement and support and all the things you've been so passionate about when it comes to mental health. And we're happy to see Craig Rice here today as well, and all of your support over the many years for supporting funding, continuing funding for things that work and expand. I'm going to speak to a couple things along the vein of collaboration. Just as another example, we collaborate often with the Alcohol and Other Drug Abuse Advisory Council, or AODAC. We have a liaison who goes to their meetings, and we go to each other's meetings when there are important joint topics, including budgets or bills that may affect our priorities jointly. We also work a lot with other entities and boards, as you've talked about the collaboration, such as Healthy Montgomery, the Commission on Health, MCC PTA, Asian Health Initiative, and other groups, boards, and commissions. I do want to point out a recent set of data that just came out that is very impactful with our work, and we need to talk about, the data on county overdose and suicide data that was recently produced, and just the idea of continuing to focus on the collective efforts to address self-injurious behaviors in relation to both addictions and suicides in the county over the next coming years. So just pointing that out as an ongoing theme. For our priorities, you're very familiar, and we've met with you many times over the years. I just wanted to point out the first two in our priorities. We want to thank you for continuing to support Mental Health Court. You see the success. You continue to push for funding. We greatly appreciate that, and also with STEER, and we've talked about that over the years. The Restoration Center idea is finally getting that seed planted to think about a location. We appreciate that effort that we've been asking for over the years to look at. I know we've had conversations about a plan and developing some kind of, center located near the detention center, having a space that is starting to roll out a little at a time. We would like to encourage some kind of temporary location in the meantime while that permanent location is being constructed. And that would go along with our priority to continue to advocate for the full continuum of criminal justice programs, including mental health, court, deflection, diversion initiatives, and the goal of decriminalizing mental illness and substance abuse. Our second priority I want to speak to today is we've added a few things this year, and again, you've been privy to that, to expand access to mental health professionals, especially through innovative approaches across the lifespan. And we've talked about the shortage of psychiatrists, but we also have needs and shortages in other mental health professional areas in a variety of disciplines, and we've talked about that with social workers, professional counselors, nurse practitioners, expressive therapists, ESOL counselors, elementary school counselors, and the list goes on, and those who are bilingual and speak the languages of our county residents to support the population that's changing in our community. Of course, across the lifespan, we're talking about a concern that we have some shortages and vacancies in the county-run behavioral health programs that are so critical to our citizens. And we struggle to fill those positions for a variety of reasons, and those include managerial positions and providers like social workers and clinicians. There's, again, a lack of bilingual providers and applicants, the non-competitive salaries in many cases, and the length of time it takes to complete the recruitment, hiring, and onboarding process. So we've talked about that concern. It's still a concern. So we'd like to continue the efforts that are currently being made to make the hiring process more efficient, shorten the length of time for the hiring so that more people can be brought in more quickly without looking at other positions elsewhere. We want a new staffing study to be funded again. It's been done in the past. We'd like to look at it again to examine the salaries of psychiatrists, therapists, and other psychiatric nurse practitioners, possibly to find out what are the competitive salaries out there so we can maybe address these shortages a little more strategically. And we also just want to continue to look at telehealth and Keeping the Door Open Act that were passed in Maryland this year that also help us look at the shortage through other ways like telemedicine, consultation models that are coming into a more innovative way of looking at things. And these can be funded either.
Ask you to wrap up.
Yep, this is my last comment. Can be funded either or administered by the county government, like the model in Massachusetts. So thank you.
Very, very good. I don't think there will be time to get to it in this council, but I would certainly encourage the next HHS committee to take up the workforce issue. What is the shortage of providers? What are the salary scales? Are we competitive with the private sector? The private sector is also facing shortages.
Yeah.
Thank you very much for
Thank
your excellent presentation.
Thank you.
Okay, let's hear from the Latino Health Steering Committee.
Good morning.
Good morning.
Thank you. Thank you for inviting us to be here and to share with you what our policy priorities are for FY 2019. My name is Henry Montez, and I am with my colleague, Monica Escalante, and she and I serve as co-chairs of the Latino Health Steering Committee. Monica was recently elected co-chair, so she's starting out for us. Again, thank you for this morning's hearing. The steering committee is an independent group of volunteer professionals and community leaders advising and assisting the Latino Health Initiative. We also advocate for all the aspects of health and well-being for the Latino community in the county. Our two major policy priorities, actually our first one coincides with the Montgomery Cares group in terms of a priority, and that is ensuring safe access to public benefits and programs for the county Latino population with the objective of ameliorating the impact from the proposed changes to the federal public charge rules regarding immigrants. And this has been an ongoing, our ongoing role in terms of advocating for the Latino community, and the collaboration with other groups has been essential in order to ensure that the Latino community is being served well. And that's the public charge issue brings the to the fore the issue of accessing public benefits and programs that are the responsibility of HHS, and we are working closely with HHS on a number of these. I think this priority will also include our venturing with the new administration on having an understanding to address the policies and procedures that are needed to alleviate the impact of the public charge proposed rules. Our second priority is to work toward integrating health equity into the implementation of the County Council's resolution on an equity policy framework for the county government. The County Council resolution talks about equity lens, and then to determine who benefits from public policies, regulations, and practices, and the development of equity tools and plans to inform local decision making. And so it fits with regard to the health equity issue and how the Latino population is receiving or not receiving appropriate services in the health arena. And that, I think, helps us to position the concept that we use in the steering committee of social determinants of health, addressing those to gain, if you would, a broader coverage of health equity. And so, and this goes along with the health in all policies that the county has been working with through Healthy Montgomery. So it's really right in concert with what our thinking was. And so we feel that with this now being a county, a wide proposal to our framework, that health equity and specifically with our Latino community would work. But one of the things that is going to be needed is culturally and linguistically relevant policies and procedures for the Latino experience, I think, and I'm sure other populations that have those issues as well. So the steering committee continues to work closely with the Latino Health Initiative in addressing the policies for the blueprint for Latino health of Montgomery County, and so this is in concert with the priorities there. Also, we have the priority of the conversion of 4 positions, and we're suggesting, we're going to advocate with the new administration for an ombudsperson to be at the office of the county executive to help influence health in all policies and to maintain a strong equity lens for all the county operating units who are identified as social determinants of health, so that the influence will be through a number of organizations.
And I want to take the opportunity to thank the HHS committee chair for responding to a request to ensure that the process for conversion of the 4 positions is in motion. We appreciate that greatly. The steering committee continues to count with your support to provide necessary resources and policy perspectives that are important to continuing our work and build our successes as we move forward with our priorities. So thank you so much for your support.
Yep. Very good. I'm glad to see the Latino Health Steering Committee paying attention to the dialogue about the equity lens. There's a national organization, the GARE, which brings together efforts like this across the country, and some of the leading counties that have launched efforts at implementing equity throughout county services are King County, Washington, Multnomah County, Oregon. Multnomah County, Oregon, which is where Portland is located, is not very diverse. King County more so. I don't know if the implementation of these policies, I can tell you that they have not resulted in revolutionary redistribution of wealth and resources. I don't know if you could say that Seattle or Portland or their surrounding jurisdictions are fairer and more equitable today as a result of these policies. It'll be interesting to see how the new executive and council proceed with this conversation, but we're not the first to embark upon this. I think it is crucially important that affected communities, including the Latino community, really pay very close attention to this. Right after the election, there was a great upswing in activism and #resist movements, and I went to a number of those meetings early on, and I too, was anxious and worried about the turn the country was taking and the dialogue of exclusion and intolerance. But what I found frequently was I would go to these meetings, and there were a lot of woke people, but none of the constituencies that they wanted to lift up and value and appreciate and love were present. And I went to meeting after meeting of activists who resemble me, expressing concern that representatives of the affected communities just never come to their meetings. We keep inviting them, they never come. And my advice to those who seek equity is don't expect people who are on the losing end of the equity question to come to your meeting. If you seek to influence public policy, you need to go out into the community. The next meeting of the woke coalition for justice for all may not be where hardworking people who are on the losing end of economic and racial inequality, they may not want to spend their time in your meeting. And it will be important, because the county government is going to have this dialogue, that existing structures like the Latino Health Steering Committee and others who are here pay close attention, because it may well be that the agenda and the priorities will be set by well-meaning people, but not representatives of the affected communities. So that's something to watch very carefully, because we don't know who the next executive will be. We've got a pretty good idea of who will sit on the next county council. There's a lot of interest in this, and good things can be accomplished. There's no doubt in my mind, but it has to be more than if there's going to be, the question is, what are the outcomes? I think it's helpful at this moment in history for everyone to become educated about history and about inequity. But if it's just talk, you can end up with people feeling more frustrated and feeling more left out than ever before. So, I welcome the Latino Health Steering Committee's focus on that. And what is the status of the proposal to make advancement in immigration status contingent on the drawing down of public benefits? What do we know about that today?
It's during its 60-day comment period in the Federal Register. So I think that's going to be probably beginning of December.
And it being precisely what? You can't get a green card if you've used any public benefits?
You know, there are 445 pages in that proposal.
Okay.
But the main scheme is to use any kind of public benefit that you receive as an excuse to deny any kind of citizenship or green card.
Right.
Okay, that's the bottom line.
And that could include county services.
Oh, well, it only includes federally funded activities. And that's one of the reasons that we feel it's important to work with our colleagues in the nonprofit world, as well as obviously with the county government, in terms of teasing out where these things, where these benefits and services can legally be, taken up by the county versus the state versus.
But as proposed, for example, Proyecto Salud is funded. Well, of course, it's a Medicaid recipient, so it's hard to
Right. But
it's hard to distinguish if you're only getting county-funded services or if you're at a facility that is getting federal funding, even if you personally are not the beneficiary of federal funding.
Right, and those are the kinds of maneuvers that, we just have to put our heads together with regard to, what the population is willing to access, to be honest. I mean, I think part of the thing is that they've really scared the population into not wanting to get any services. And so now we have kind of a dual role of advocating to the population that there indeed are services that they can access, and that, they're not going to be liable for immigrant problems. So, yeah, it's very complex in that regard, and that's why we believe you can only do this through a collaborative arrangements and to coordinating with other groups. And I was glad to hear Montgomery Cares Advisory Group, picking up on this, because I think that's part of, a large part actually of kind of clinical services that we're going to get. So those. And
if I could just add, this version of public charge was a little better than the versions that were released in March. They do not include immigrants who apply for and get qualified health plan membership sign on, which was really important. It also is silent on MCHIP, which from mothers and children is really important. It also excludes emergency Medicaid. So it's a little bit better. We wish it didn't exist, but it's a little bit better. The bigger challenge, I think, is how do you, the one thing it does say quite clearly is that folks who are signed on to benefits before this public charge would go into law would be exempt from any penalties. So it's sort of prospective, not retrospective draws. So at a minimum, people should come and sign up for benefits now. That's one message, but it's very hard. We're working to try to figure out what's the messaging we want to put out there, because we certainly don't feel like we're in a position to say, don't worry about this entirely, because we've been proven wrong over and over again. But at the same time, we don't want children to go hungry and people to be without health care or housing. That's a core mission. So we're getting, in fact, we've asked MPI, the Migration Policy Institute. They have an expert over there who's been particularly working on public charge to come and do a training for our staff and to try and sort this out. We're signing on to pretty much every statement from CLASP to APHSA to every other organization that's putting something out there. that says here are, for us, the comments on public charge. So we're trying to be activists without putting a big target sign on our faces. So.
Thank you. Very important issue.
I just want to thank you, Councilmember Leventhal, for all the help and support you've given us over the years. So we really appreciate that, and I think it's brought us to a good place in terms of our trying to influence the system. So
thank you, Henry. Okay, very good. Thank you very much for the excellent presentation. Let's hear from the Interagency Commission on Homelessness.
Good morning.
Good morning.
My name is Brian Tracy. I'm a public representative to the Commission, and I also serve as Vice Chair of the organization. I would also like to begin by first thanking Councilmember Leventhal for his past work in support of homeless issues across the county. And then I'd also like to recognize Councilmember Rice, both for his past work, but what we also hope to be his future support for the issue of homelessness. And I have a few things here that no doubt we will be asking you to sign on to over the years. So let me begin by just briefly summarizing the objectives of the county as to homelessness. And then I'll talk very briefly about this, how the ICH supports the county in meeting those objectives. And then finally, the last role of the Commission in providing innovative ideas. First, our objective is to sustain functional zero for veteran homelessness. As many of you, probably all of you know, in the audience, Montgomery County did achieve that goal a number of years ago in 2015, but that's a goal that needs to be addressed day by day, week by week, month by month. So we will continue to remind everyone in the county that our work is never finished there. Secondly, we are almost finished in ending functional chronic homelessness by the end of this year. There should be an announcement within the next 30 to 60 days that we have met that goal. We are one of very few communities, or will be, one of very few communities in the country that will end functional chronic homelessness. We won't congratulate ourselves yet, though. Then in fiscal year 2019, we will turn even more attention and more resources to ending both family homelessness and homelessness for unaccompanied youth. The last objective I'd like to spend a little bit more time on is the glaring racial disparity among people experiencing homelessness in Montgomery County. Now, I've shied away from facts and figures, the numbers and the data, because the big picture here is what's more important. But here, I think it's important that we stop and look at the statistics. So people who identify as black in Montgomery County compose less than 1 out of 5 of the general population, but yet almost 2/3 of the people experiencing homelessness are black. Whereas people who identify as white in Montgomery County are more than half the population, but make up just about 1/4 of the people experiencing homelessness. This is an issue, I think, that we've not talked enough about within the ICH, and we will be changing that in the year ahead. Let me then talk briefly about what the ICH will do to support the county in meeting these objectives. As we enter the end of the 4th year of the ICH, we are stepping back, I think as appropriate, to look at its governance structure, particularly the role and purpose of committees. Also providing additional clarity to commission members as to the expectations for their involvement in the group. And then finally, stepping back and taking an even broader look at the purpose of the commission itself. I think our role also in supporting the county, given the upcoming election, is to educate, inform, and make recommendations to newly elected council members and the council executive. So we will be focused on that as well. 2 specific areas, in conclusion, the ICH, as it's required to do, will be evaluating its coordinated entry system in accordance with the requirements of HUD. And then finally, we will be also looking at a more efficient, more tactical use of the existing programs in the county. So I have two final comments, just very briefly. And you can see this from the remarks or the comments that were prepared. But the reason for the success the county has had is the integration across the county and even sometimes with the federal government. That's how we will continue to sustain functional zero for veterans homeless. There's a mention here that the entire team of providers, HHS staff, and VA staff meet as a group to discuss all open cases and the expected timeline for the veterans to be permanently housed. So that type of collaboration, integration needs to continue. And then the last comment I would make is in terms of the other role of the ICH, which is to step back from what the county is doing, because it's difficult sometimes, I know, and I've seen the dedication and hard work of the county employees. It's very impressive. But to pull back from what you're doing and this great work and to say, well, is there something else we should be doing? Is there another way? So the role of the commission is to provide that comment as well. So I just point out one thing that you mentioned, Councilmember Leventhal, about King County, Washington. This may be something that the Montgomery County may want to consider as well. In King County, legislation was recently passed that requires excess proceeds from the sale of any property by any agency in county government to be devoted to affordable housing and homelessness. That's landmark legislation. I believe it's the first of the kind in the country. But those ideas and others are, I think, some of the innovative and creative concepts that the Commission will be presenting to county government. Thank you.
Great. Brian, thank you so much for your work with the Commission. I do hope that the Commission will follow along with the Victim Services Advisory Board suggestion and as part of the Family Homelessness Initiative, as I mentioned earlier, there's a disproportionate number of families that have suffered from domestic violence that are in that pool, and it may well be that, that prioritization is always necessary. It may well be that could be a particular focus area. So,
and we will.
I think that's a great point from the Victim Services Advisory Board.
Thank
Mr. Rice? Yeah,
I couldn't agree with you more. I did want to go back to one of the points that you made about the racial disparity piece, and it's something that we in the community have been talking about for quite a long time, and it's one of those that, again, ties into, and this is why all of these priorities oftentimes are cross-pollinated and lumped together, is that if African Americans are the highest portion, and Latinos, but it's African Americans who are actually higher in terms of unemployment, then of course they're going to be higher on the homelessness scale. I mean, and so if we don't have the jobs that are there for our young folks, I mean, it was in the context of this conversation about the minimum wage and talking about how the minimum wage is great for people who have jobs, but for those who are unemployed, it doesn't help them. And so from that perspective, we've got to get real and serious about that piece if we want to affect it. Housing somebody is great, but if they can't be sustainable by having a job and us focusing on workforce development, education, making sure that we bring folks up in terms of the disparities that exist in achievement and equity gaps in our schools, it's all tied together. And that directly leads to folks then, not being able to afford to live in one of the richest counties in the nation. And so from that perspective, I applaud you for highlighting this. It's incredibly important and something that, again, ties into what LHI was talking about before. All of these things are woven together, and really we need someone who's looking at this from a total policy perspective. It's the reason why Councilmember Navarro was really high on pushing forth this equity lens, because having that lens to look at all these different things and say how they affect our communities that are at risk is incredibly important, and looking at the overarching policies and decisions that we make as a whole, weaving in what those implications may be for our at-risk communities. And so I just wanted to say thank you for highlighting this. I think it's important that in all of our contexts, and it applies to mental health, it applies to everything, it's all the same, to where we, if you can't afford to live somewhere, how can you afford a therapist? And even if you had insurance coverage, right, you got to pay up front. And are you going to pay your rent? Or are you going to pay the therapist to give your child the mental health they need so that they can stay in school? It's just, again, it's a lot, but I really appreciate you putting it on there because it's incredibly important and we need to start thinking about this in a greater context. So thank you.
Thank you for that support. Much
Yeah, I
appreciated.
really appreciate Mr. Rice's longtime involvement in the homelessness issue. I delved very deeply into this issue in particular. I think, we started out talking about the overlapping and overarching need to understand all of these different missions together, and I do agree with that. And homelessness is when everything fails, when every system has not come through, every effort to help with housing, family, personal connections, everything, and it's the worst possible outcome. So there is like a hierarchy of how bad things get, and people suffer from hunger, and people suffer from lack of access to care, and people suffer from domestic violence, and people suffer from abuse, and people suffer from family breakup, and then the end result of all of those systems breaking down is someone has nothing, no place to stay, and homelessness is the absolute bottom. And so there is the understanding of how homelessness connects mental health, substance abuse, every single one of these topics, directly incarceration, juvenile justice, everything, foster care, so much, does connect to the homeless.
Yes.
When everything fails, when nothing we've done is successful, and then the individual ends up homeless. So it is an issue of extraordinary urgency, and I think I've been perhaps too visible on the issue with respect to the other 8 members of the council. They've always supported the initiative, but I would say Mr. Rice, other than myself, has really done the most to spend time on the issue, learn about the issue, work with the providers, and that's going to be crucially important. And I would say that to the advocates in the community, people have been asking me, because I have been so closely associated with the homelessness issue, well, who will be our champion now that you're leaving? And the answer is you can't afford just to have one champion. You got to have 5 council members to get anything done, and ideally it should be 9. And it is important for all the advocates not to concentrate just on the committee chairman, or not to concentrate just on the council member who launches an initiative or sends out a press release or that kind of thing, because if you don't have a knowledge base among other, the homelessness issue is very complex. All of these issues we're talking about today are complex. And the briefings and the interaction and the giving awards at public ceremonies and that kind of thing can't be limited just to one council member, because ultimately all of us will come to an end of our service, and someone else has got to step up and play that role. So with respect to homelessness, I think the community has high expectations for you, Mr. Rice.
Yeah, we do. Yes, we do.
Let's hear from the Early Childhood Coordinating Council.
Good morning.
Good morning.
My name is Michelle Green, and I'm the current chair of the Early Childhood Coordinating Council. We call it the ECCC. The ECCC was established by Bill 1315 and is Montgomery County's local version of the state of Maryland's Early Childhood Advisory Council. The ECCC monitors, advocates, and makes recommendations for the development of a comprehensive system of early care and education in Montgomery County that supports children entering school ready to learn. The ECCC is comprised of a variety of stakeholders and professionals with expertise in the early childhood field. Our collective knowledge and expertise helps the ECCC to examine, discuss, problem solve, and provide a comprehensive perspective about early care and education to county officials. Our priorities are noted in the written submission. I'd like to highlight a few of the key issues. One, we're working to create a forum for effective communication and coordination between stakeholders. Montgomery Moving Forward has selected early childhood as its collective impact initiative, and there are many other boards and commissions that have a focus on early childhood. Building a seamless system of early care and education requires connections across a variety of diverse stakeholders, and that requires that resources and priorities be aligned. The ECCC will work to facilitate communication to create an aligned system in which all children have access to high-quality learning experiences. We also are helping to advance the county's early care and education strategic plan. The county's budget since the release of the plan have not fully funded the key findings and recommendations. The ECCC will seek to continue to assess the quality and funding for early childhood care and education services and integrate its feedback to align with the county's budgeting cycle. We also are working to monitor the recommendations from the state's Kerwin Commission, Working Group 1, Early Childhood Education. As the Kerwin Commission finalizes its report, the ECCC will highlight how this state framework should align with the unique challenges and needs of the children, families in Montgomery County. The availability of funding and the implementation of a diverse delivery system that includes child care providers will be among the challenges that require thoughtful execution. Finally, evaluating the impacts of the county's Working Parents Assistance Program, WPA. In August 2018, the state issued an update to voucher rates and eligibility income levels in its child care subsidy program. The program expansion has resulted in many families in Montgomery County receiving notice from WPA that they must transition to the state CCS program.
And that's good news.
It is good news, indeed. The ECCC, however, will work to monitor the impacts of the transition and ensure that county WPA funds are preserved for supplemental vouchers and that WPA continues to be available for working families in the county.
Great.
And that's all I have prepared for you. Thank you.
Great, great. Well, those are also, I think, they will be very, very high priority issues for the next executive and next council. A lot of the folks who, during the campaign season, talked about early childhood as, the top priority. Again, we don't know precisely how the election will turn out, but I think that these issues will get a lot of focus, and the interaction between, on the one hand, reducing the achievement gap, and on the other hand, allowing parents to earn a living and support their families and provide stability, make this just a super virtuous issue. I would anticipate this will be, if not the #1 issue, but right there in the top couple of issues for the next group of elected officials. Mr. Rice.
Yeah, I actually couldn't agree more, and I'm kind of jaded serving on the Kerwin Commission, Working Group 1. So I really had a great time in front of the Early Childhood Coordinating Council and being able to talk to you. And one of the things that we continue to talk about in the state when we talk about the hopeful implementation of Kerwin Commission recommendations, Montgomery County as a whole spends a lot of money on things that we know that are incredibly important. And as we see the state catching up and starting to support these initiatives, it gives us the ability to be more targeted in terms of, and so I couldn't agree with you more, utilizing those funds to be able to be even more strategic in getting at the folks who need those supports and really need that helping hand. Plus, there will be, again, with our recommendations coming from Kerwin, sliding scales. And so from an affordability perspective, we'll want to make sure that we can do everything we can to continue to ensure that those early childhood education opportunities are affordable for all parents here in Montgomery County, means that we can be more strategic about how that money goes too. So thank you for putting that in there. It's a very incredibly important point and highlights there will be more. When it comes to the money we spend on special education, we spend on English language learners, all of those kinds of dynamics, as hopefully money follows, as Councilmember Leventhal said, if the election bodes well and we have folks who understand and are committed to education and ensuring that we're funding those recommendations, then we'll see that additional money, which will give us the ability to do even better things than we have been doing here. And so I just really want to thank you for your great work. Thank
Indeed.
you.
Great. Thank you very much.
And we look forward to being your partners going forward.
Excellent. Okay, let's hear from the Montgomery County Community Action Board.
Good morning. My name is Laura Irwin, and I am the chair of the Community Action Board. We are the federal government designated anti-poverty group and the governing body for Head Start and the Community Action Agency. I thank you very much for the opportunity to share our priorities, and I am only going to go briefly over some of the comments as you have the full report in front of you. I don't want to repeat what has already been said about early learning and childcare, but I do want you to know that we are very committed to providing high quality early care and education. That's one of our priorities as the governing body of Head Start. And as a responsibility that we share with the Head Start Parents Policy Council, and we work very closely together with them to make sure that we are in compliance with the Head Start grant that we have. And our board greatly appreciates your work and your efforts to reduce the burden of by increasing funding to the Working Parents Assistance Program. And again, since we already talked about early child care, I'm going to go ahead and talk about VITA. Our board appreciates your continued support in the Community Actions Agency VITA program, and that's where we deliver free tax preparation services to about 2,000 lower income residents each year. That's our continued priority, to make sure that we can provide that service to our low income residents. We also like to continue support to our Tacoma East Silver Spring, also known as TESS Center. We're concerned a little bit about the fact that we've had some extended periods in staff vacancies. However, we appreciate the fact that you continue to monitor this with us, and we will continue to make sure that we continue to provide services to our key partners, Judy Center, Pro Bono, Impact, Cheer, and Mary Center, along with our Community Action Agency Senior Group and the VITA program. Also the Summer Meals Partnership with Montgomery County Public Schools, where we served over 1,890 meals last summer. One of our jewels, our crown jewels, is our advocacy training and our group where we prepare county residents to become self-advocates. The Community Action Board Institute aims to train lower income residents to be advocates for their communities. We have graduated 34 residents, and this year we have 24 residents that are registered to participate in our program. Another priority is our data reporting. We would like to comply with the new federal and state performance management and reporting requirements. Our board is aware that the agency is working internally and with PACS and Head Start to strengthen our efforts to capture demographic and service data so that we can make sure that we accurately report the number of participants and the number of services. As we were talking earlier, I've listened to the reports that have been presented before me. Our board is also committed to a multi-generational approach to reducing poverty. What that means is that we're also going to seek the support and continue to support the efforts of those who are fighting homelessness, who are fighting to provide services for mental health services. Also look into the post-secondary education and employment pathways for our residents. Make sure that we can look at their economic assets, their health and well-being, and of course the development of their social capital. As another priority that we have is food security. Just this past week, I participated in a focus group where we ask our residents about food insecurity and ways in which they can be participants and advocates to give us some information on what it is that they are currently using to make sure that they can receive the necessary help in order to feed their families a healthy and balanced diet. We will make sure that we present the results of those focus groups. And of course, we want to make sure that our parents have access to, and not just our parents, but our county residents have access to programs where they can go ahead and become self-sufficient. And like Mr. Rice mentioned, the importance of having people have jobs that are going to be able to provide them with wages that will help them become self-sufficient.
The Community Action Board is the entity that does the leadership training for
That is
people
correct,
from
yeah,
affected
that's our Community
communities.
Action Institute, yes.
Right, right. That's a really worthy effort.
It, absolutely.
As the council's representative to the Interagency Commission on Homelessness, I cannot emphasize enough the need for involvement and participation from the client communities. We're woefully short, I think, in policymaking, and we really can use a whole lot more. And it speaks to what I said earlier about the equity agenda. You know, if the whole conversation about the equity agenda is driven by people who are very well-meaning, but who are on the winning end of that inequitable distribution of resources, we're not really going to make progress or understand what's going on. So I absolutely encourage, I think that's a very, very worthy enterprise to continue with that leadership development.
Thank you. Yeah, we appreciate your support. And also our board is conformed of, third of our board members are participants from the low-income community.
Right.
So they are able to also inform some of the priorities that we have as a board.
Well, that's great, and I would encourage the board not only to have leaders from the community on your board, but to identify opportunities to serve on the other boards and commissions
Absolutely, and that's
represented here.
why the Community Action Institute is so crucial in that participation.
Yeah, I think that's a really, really worthy
And we
endeavor.
appreciate the fact that other commissions have sent us participants to join the effort.
Thank you. Thanks very much.
Thank you.
Let's hear from the Commission on Veterans Affairs.
Can I just make one clarification in the note? We do not have a savings plan. We're not operating under a savings plan. It's just the time it takes to hire positions. It's, we have a lot in play right now.
Thank you.
Just want to clarify that.
Commission on Veterans Affairs, is anyone here? If not, let's go to the Commission on People with Disabilities. I saw Dr. Morgan.
Good morning, and thank both you, Mr. Leventhal, and Mr. Rice for all the wonderful things that you've done to support us over the years. It has been recognized and appreciated, and we will continue to hopefully work with Mr. Rice going forward. We have 4 priorities to comment about. First is caregiver support. Obviously, in order to keep people with disabilities in the community, some people require caregiver support, and that often is the family member. But they need respite. They need a chance to get off and be able to do the things that you want to do with your life, and have someone come in and take care of their loved one. The problem that we're having is that the recent level 1 rate increase from $14.50 an hour to $20 an hour, and the level 2 from $25 per hour to $40 per hour has created a shortfall in support availability. We would ask for additional funding for the respite caregiver support.
Sorry, I don't know what that is, level 1 and level 2. Who's paying and who's getting paid?
Well, I think it's a matter of the credentials of the individual. That level 2 have more technical ability to help people in the home setting. Level 1 is more just, the typical washing and changing the bedding. And
these are state rates?
This was the rate that we had in our contract with the ARC of Montgomery County, and they were having difficulty recruiting providers because the rate is so low.
Yeah.
And so they asked for an increase in the rate in order for us to, there were no, given that the program is level funded, the increase in the rates, which we had to do because otherwise people weren't getting service, resulted in a decrease in the hours. But it's sort of capped. The hours are capped right now, the respite care hours. You will get this amount of hours in the course of one 12-month period of time, and it depends on how you spread it. The county pays these resources.
These were the terms of the county's contract with the ARC.
Yes, yes. So at the moment, we've done the calculation based on need, and there is a average set number of hours capped annually that families can use. And given that it's respite, it's not taking the place of in-home aid services or home care. The cap has to be used in the way that's most useful to families. And so there is, as a result of that, it's not an open-ended service. That's what's different about this.
Thank you. Please proceed. I'm sorry to interrupt. I just didn't know what level 1 and level 2 were.
That's fine.
I didn't understand.
It's always good to get the clarifications, right. Absolutely. Our second priority is on employment. The proposed changes in Medicaid waivers, Division of Rehabilitation funding, there's a need to increase funding for employment opportunities for people with disabilities in the county and the private sector. There is a general trend within DOORS to give priority to transitioning youth, which is understandable. However, this creates a pitfall that people who develop disabilities after the age of 21 or 26 do not have the support or the funding in order to help find employment, and we would ask for funding to adult onset disability individuals. The third priority that we have is to increase recreational opportunities. It is our understanding that therapeutic recreation has only one bus that people using wheelchairs can use. This basically knocks out a large proportion of people who are wheelchair bound, who would like to participate in recreation, and we would ask that buses be made accessible across the board as best possible. The fourth point is pedestrian and bicycle safety. Many commissioners have been quite concerned about the increase in bicycle lanes and floating bus stops and parking along bike lanes and two-stage turn queue and bike boxes. There needs to be more input from our commission and our population when these designs are made. For instance, if you have a decrease in the sidewalks next to a parking spot, people who require vans that have ramps can't lower their ramps because of the loss of the space from the bike lanes. We would like to see the bike lanes separate as much as possible, but understand that retrofitting with some of our road systems is not possible or easy at best. And quite frankly, there is a concern that often bicycle riders do not follow the rules of the road. They do not stop at stop signs. If you are blind, you may not be able to see someone coming down the road at a high rate of speed on a bicycle, and you won't hear anything. The design that has been used with having different colors on the ground to identify places where people should not be walking or should be walking is a problem, because if you have a service animal, they're colorblind. So, you know, we see this as a great danger in terms of people who are pedestrians, and we would like to be more involved with the design process, because quite frankly, we've been presented with designs that have not taken our input, have not asked for our input, and we need to be more centrally involved in that process.
Wow, that's extremely interesting. Thank you so much. That yeah. I don't think that would have come to our attention other than through this setting, so that's really, really helpful. And it's outside the ambit of the HHS department, but what I will do, I'll ask Vivian and Walt to make sure we get the appropriate people in MCDOT and also the planning board to make contact with the Commission on People with Disabilities about the design of bicycle facilities. That's extremely helpful.
Thank you.
With the bicycle master plan before us right now, but it's just a plan in terms of the detailed implementation. The fact that the council is about to vote for the bicycle master plan in no way precludes ongoing conversation about how the facilities are designed to make sure that they are sensitive to the needs of people with disabilities. There's still lots of opportunities for input on that, but again, I'm going to ask staff to make sure that we follow up from my office with MCDOT and Planning Board to make sure that this concern is amplified and that there's an opportunity to continue to talk about it.
Yeah, and we've always had very good communication with the DOT, so I'm not concerned about that. I'm more concerned about making sure that the issues that people with disabilities have are fully considered in these design issues.
But you've been heard this morning, and that's a very, very important point that I don't think we would have gotten in any other setting. So thanks to the Commission on People with Disabilities, Dr. Morgan. Let's hear from the Commission on Juvenile Justice.
Good morning.
Good morning.
I'm Christopher Fogelman. I'm the chair of the Juvenile Justice Commission. The Commission on Juvenile Justice recognizes the importance of supporting and advocating on behalf of opportunity youth, generally defined as people between the ages of 16 and 24 who are neither in school nor working, and some of whom have been involved in the juvenile justice system and some of whom have been detained. These young people represent a social and economic opportunity. Many of them are eager to further their education, gain work experience, and help their communities. The Commission on Juvenile Justice priorities for fiscal year 19 reflect its commitment to promoting these young people and enriching Montgomery County through the opportunity that they represent. Our Government and Community Relations Committee is going to focus on researching services available for female detained youth and advocate to close any gaps in services. The committee will look at best practices in community youth engagement and develop partnerships for engaging at opportunity youth. We also will research and advocate for alternative treatments for female juveniles. Our Care, Custody, and Placement Committee is researching how the Commission can best advocate for effective educational and vocational training programs for youth who have been detained. The committee will identify educational and vocational programs that are available at the facilities and look at the effectiveness of those programs. We plan to work to strengthen capacity of the Evening Reporting Center and identify other agencies that are providing services and look at the effectiveness of those programs within those agencies. The committee will make recommendations on how to collaborate with the Maryland State Department of Education, which runs the educational program at the juvenile detention facilities in Maryland. We'll focus on the educational program at the Alfred D. Noyes Detention Facility and also how we can assist in bettering their program. In order to carry out our mission, the Commission on Juvenile Justice regularly receives updates from the Collaboration Council on Children, Youth, and Families, the Juvenile Justice Monitoring Unit, the Noise Advisory Board, the Commission on Children and Youth, the State's Attorney's Office, the Public Defender's Office, the Maryland Department of Juvenile Services, Child Welfare, and the Criminal Justice Coordinating Council. Thank you.
Excellent. Thank you very much. Appreciate the presentation. Mr. Rice? Yep.
Christopher, I did have one question in terms of, and I certainly agree with your focus, but were there numbers that you saw that are the reasons why you decided to focus on female incarcerated youth?
That's one of those things that's a result of the fact that there tend to be numerically less females involved in the system than males. And because of that, there's a greater availability because there's a greater need with the males. And it's been our experience that the females tend to be, I won't use the word overlooked, but it's less of a focus because there's simply less females involved. And we have looked at the numbers. We do get numerical and statistical updates from the Noise Center and from the other agencies, as well as the Juvenile Justice Monitoring Unit.
I think it's great, and I think that, again, an opportunity as you're researching services available. I know that Crittenden does a great job in working with at-risk girls in our communities, and so being able to partner with them as they're working with at-risk girls in our schools and trying to give them the guidance so that they don't get to this point would certainly be a collaboration model that I think would work effectively for you. It's just one, but they've been expanding, working in the District of Columbia, and now expanding into Montgomery County at a number of schools. And so I would encourage you to take a look at that model and talk to them as they could give you some guidance in terms of what next steps may be in terms of outreaching, since those populations are very similar.
We will. I
Thank you.
appreciate the input.
Yep.
Thank you very much. Let's hear from the Commission on Health. Anyone here from the Commission on Health? All right, if not, let's hear from the Commission on Children and Youth.
Good morning.
Good morning.
Excuse me. Good morning. My name is Kirsten Anderson. I'm the chair of the Commission on Children and Youth. The Commission promotes the well-being of Montgomery County children, youth, and families so that all young people may realize their full potential and become contributing, productive adults. We're one of the only commissions with youth members. Our two priorities this year will be, one is on mental wellness. So in today's environment, our students experience stress from a variety of sources, whether it's due to poverty, school, or home environment, cultural expectations, or other external or internal sources. The Commission wants to explore ways to promote positive approach to mental health and well-being that is accessible to a wide variety of the community. We chose mental wellness because of its applicability to all youth, separate than mental health. We wanted to focus on mental wellness, which is promoting optimal functioning and increasing each person's ability to cope with normal stressors. The second priority area is related to safety. The Montgomery County Board of Education unanimously passed a resolution focused on the safety of student and staff. Similarly, the state of Maryland passed the Safe to Learn Act in 2018. The Commission is concerned about A, balancing the psychological and physical safety in Montgomery County schools, and B, providing a safe environment for students during non-instructional hours, including after-school activities on campus. So the Commission will examine current initiatives, support, and services in order to identify gaps, opportunities, and recommendations. And then lastly, we are holding our annual Youth Having a Voice Roundtable. It'll be on Thursday, February 7th at 2019 at 6:30. It'll be at the Silver Spring Civic Center. It's our 12th year doing this. It's hosted by the teens on our commission. And it's a chance for youth to come speak, and primarily also for adults to come hear from the youth of the county speaking to these two issues specifically.
Thanks. And of course, the day after tomorrow, the evening after tomorrow, October 24th, the County Council's hosting a youth town hall right here where we're all sitting as well. I hope the Commission on Children and Youth, you've historically helped us get the word out about that, and we could do another round of social media and all that. We also are seeking, the County Council is seeking the input of our youth. In between your two priorities is the issue of school shootings. And I just wonder how much conversation the Commission has had about the mental wellness and safety elements associated with that. Right after the Marjorie Stoneman Douglas shooting in Florida, I visited a couple of high schools, and it was very recent, so it was very much on the students' minds. There have been other school shootings since then. How does that fear, in the Commission's experience, rank among the stressors you list? Poverty, school, home environment, cultural expectations, external and internal sources as stressors. How does that particular fear rank in terms of the stressors that you all have been monitoring?
It wasn't disproportionately high, so from our youth commissioners and then from the various people on the commission. So it was one of the stressors. It wasn't the highest stressor that was there. And so, yeah, wanting to focus on giving kids the tools to handle any of those stressors that may come along.
Very good. Good. Well, thank you for your presentation. Is the Commission on Child Care represented? Good morning.
Okay, thank you. My name is Michelle Belsky, and I'm the Vice Chair of the Commission on Child Care. The Commission is comprised of volunteers from the child care community, including providers and parents, as well as individuals from the business community in Montgomery County who are dedicated to advancing our vision of access to affordable, quality care for all children birth through 12 years old in Montgomery County. In years past, the Commission has worked to advise the County Executive and County Council on important child care-related issues, including funding for the Working Parents Assistance Fund and creating a transparent and uniform system for child care in public space. There's a lot going on in child care in Montgomery County. The Policy Officer for Early Care and Education led a pre-kindergarten research group to develop recommendations and options for expansion of pre-kindergarten in Montgomery County. Recent changes to child care subsidy eligibility guidelines at the state level will impact Working Parents Assistance Fund. An increase in the minimum wage to $15 is happening at the same time child care programs are facing increased regulations and requirements to operate child care centers and family-based programs in Montgomery County. The decisions made regarding these and other issues could greatly influence child care as we have known it for many years. The Commission on Child Care is dedicated to being well-informed on the issues related to child care and advising the County Executive and Council on the impact they will have on child care programs serving children and families. To this end, the priorities for the Commission on Child Care for the upcoming year are: Priority 1, to communicate crucial child care issues to the new leadership of Montgomery County by creating and distributing publications on pertinent child care topics to the County Council and County Executive. Priority 2 is to work with early childhood groups and stakeholders to learn about and communicate pressing child care needs to the community. The Commission greatly appreciates your considerations of its priorities when making policy and budget decisions. Thank you very much for your time.
Thank you very much for your service to the community. Let's hear from the Commission on Aging.
Good morning.
Good morning. You have a 6-page report.
Yeah, right.
Awesome,
Not to worry.
but you've only got 3 minutes.
I'm Isabel Schoenfeld, Chair of the Commission on Aging. And on behalf of the Commission on Aging, I'd like to thank you, Mr. Leventhal, Mr. Rice, and Mr. Berliner for the strong support you have provided over the years to the county's older adults and their families. Thank you.
Thank you.
Montgomery County must continue to make progress as a community for a lifetime for its residents by ensuring that all access to vital services and supports essential for their well-being, including access to affordable housing. This would also help to address the results of the county's 2017 Community Livability Survey results, which indicated that despite the high quality of life enjoyed by many residents in the county, there are challenges to ensuring that people can remain here as they age and that the county's opportunities and amenities are available to all older adults regardless of income. Our annual budget recommendations are informed by the Commission's senior agenda, public forums, committees' focus areas, monthly meetings, and summer studies. These activities benefit from input and feedback from subject matter experts and members of the public. Our 2 fiscal year 20 high-level priority areas are 1, recommendations for health and social services programs, and 2, recommendations for affordable housing expansion and preservation. The county provides older adults with a wide range of health and social services, either directly or through coordination with nonprofit and other organizations. However, with our increasing older population, the growth in the number of low-income, immigrant, and culturally diverse elders, the need for these services is growing. The Commission's priorities related to health and social services include, and we have details of these, descriptions of these in the testimony that we submitted earlier. 1, expanded Senior Center Plus programs for those with early-stage memory loss, assist with increases in respite care rates and services, reinstate funding to the Recreation Department for Friday transportation to senior centers and mini trips, a new social work position in the public guardianship program, a new position, coordinator for outreach and support to older adults in diverse communities. The demand for affordable housing continues to increase. Therefore, we continue to prioritize the need for more affordable housing options for seniors. Our priorities related to affordable housing include housing initiative fund increases, MPDU program expansion, and affordable housing user-friendly database and streamlined application process, a home sharing for older adults pilot program. With the number of residents 60 years plus growing and becoming increasingly diverse, the county must continue to support critical programs that permit older adults to enjoy a high level of life regardless of income. We thank you for this opportunity to present our fiscal year 20 priorities.
Well, that was a concise presentation of a long report. Well done, well done. I want to praise all of our boards and commissions for their excellent work. I do want to say that over my years in this position, and all of the boards and commissions have been helpful and their input has been useful, I would say that the Commission on Aging and the Commission on People with Disabilities have been at the particularly high end in terms of the sophistication of your presentation, your efforts at outreach to council members. Both of your commissions are present in this building, and I invite at least me to speak, and probably other council members as well, to your meetings. So I would say to all the boards and commissions that the Commission on Aging, as evidenced by this presentation, and the Commission on People with Disabilities really are models to emulate in terms of your engagement with the county council. I think one of the things that has caused me a little disappointment over the years is that I'm able to get this input once a year from all the boards and commissions. The boards and commissions are, provide much more frequent input to the executive branch, but as a council member, I am not as frequently getting the benefit of all of these policy suggestions and insights. But the Commission on Aging, and again, these two, because they're so striking in my mind as examples of keeping me in the loop and keeping me informed and advocating. So I just want to commend the Commission for over the many years I've had to interact with you. And Mr. Berliner had a schedule conflict this morning, but he also deserves recognition. He's also departing the County Council, but he has really been a champion over his years here on issues raised by the Commission on Aging, as have I and as has Mr. Rice.
Yes.
Thank you.
Thank you.
Let's hear from the Citizens Advisory Panel for Children.
Good morning. Hi. My name is Ronna Cook, and I'm the chair of the Citizens Advisory Panel for Children. The advisory panel was established really because of federal requirement of federal legislation of child abuse and neglect to examine the extent to which the County Child Welfare Agency effectively implements the child protection standards in the state plan. But aside from that, it's also to ensure that maltreated children receive the services and support that they need. In past years, we have focused on a number of different issues, from foster parent training to foster parent recruitment to mental health services for children. And most importantly, we are always monitoring the housing and service needs of youth transitioning from foster care. Any opportunity that we have to talk about the transitioning youth, we take time to do that. Housing is such a critical issue for these youth, and we want to reinforce the importance of the issue with you. There's usually about 12 to 15 youth transitioning out of foster care each year, and I think the small number is what creates them being overlooked on one hand, while at the same time allows the fact that there's only 12 to 15 youth transitioning, and it's a great opportunity to really help address one problem. Our focus this year is also going to continue to address child safety issues in light of the growing drug and alcohol epidemic. The effort includes assessing the pervasiveness of the problem, the safety planning, the safety concerns, decision-making, and resource needs. Actually, in 2017, 41% of the 142 shelter hearings, the reason children were coming into foster care was because of drug or alcohol abuse. And of these cases, the main ones are cocaine and marijuana that seem to be the most prevalent among drugs used. And we are actually focusing on 3 areas related to this. The first is data and data quality. The goal is to obtain better data on substance abuse across the children, the parents, and foster parents to provide timely and effective services. But we are working with child welfare to enhance those processes left to the county, because right now the state is also redesigning the data system for child welfare. But one of the hopes that we have is to be able to help to standardize questions that are going to be related to substance and alcohol abuse that can be reliably asked and captured on a consistent basis.
We already have the Youth Risk Behavioral Survey.
I'm sorry?
We already have the Youth Risk Behavioral Survey. Why would we not use that, which already exists and is the parameters are established under federal law? Why would we not use that as a standard survey of risky behaviors?
Well, because it's not that to replace that, but it's also when workers, it's to be able to make sure that the questions that are asked when workers walk into a home with youth and their families.
So it's a survey.
It's not. We're not even talking about a survey. What we're really talking about is just that the training of the social workers themselves that there be consistent questioning that goes across the board in their service provision.
Remember, this is in the moment of child welfare, safety assessment and planning, child removal, those kinds of decision making.
Okay. So it's not a question of prevalence in society at large.
No, not
you're
at all.
assessing a family in crisis and what's going on right there. Okay.
It's not a population indicator, but rather a case by case.
Yes, exactly. I'm sorry if I wasn't clear about that.
Okay.
The other thing is that we've also looking at the resource needs, and one area in particular that the social workers have identified for us is that there need to be alternative services for adolescents with drug abuse issues, because that they really feel that the resources that exist today don't provide the kinds of services that lead toward for prevention and/or then remediation. Adolescents need some, things that deal more with group and peer work, that are they're not necessarily wanting to sit down and just talk about their issues, and they'd like to see alternative types of services available for them. The third is collaboration, outreach, and training. And our board is working right now in collaboration with the Drug and Alcohol Abuse Commission, as well as with the Social Services Board. And one of our goals is really to make sure that our community partners consider the substance abuse issues as they really pertain to child welfare clients. And thank you very much.
Great. You are established under federal legislation. Is the name of your panel established under federal legislation?
I'm not sure about that.
Yes.
Yeah.
It is.
So each community must have a citizens advisory panel for children named that.
At least one in the state, I believe.
Correct.
Because in terms of the advisory panels, I think we're the only county that still has.
When the federal CAPTA legislation passed in the late 90s, there was a requirement. There used to be what's called the Foster Care Review Board, and there was also an intention to create something on the child protection side. And so there was the Citizens Advisory Boards created.
Okay, but here again, a more specific title. What
review
always
panel.
comes to my mind year after year is we have multiple boards and commissions that appear to be doing the same thing.
Mm-hmm.
And just looking at the title of your group, it is not clear that you are concentrating specifically on children who are abused or are in child welfare. And I just wonder if the title could be made more specific, or if we're precluded from doing that under federal law. We can look into it. We don't need to answer it right now.
Yeah. I think that the name has gone under different revisions at different times, so I think it's...
So we could take a look at that.
This is what the state has asked of us, but we can go back and look at it.
Yeah. Thank you very much for your presentation. Let's hear from the Board of Social Services.
Good morning, Chairman Leventhal. Good morning, Councilmember Rice.
Good morning.
Thank you very much for having all of us here today. You have all the details of what we have for priorities, so I will spare you talking through all of that. However, I do want to just let you know that the Board of Social Services, we support Montgomery County in an advisory oversight role with funding from the State Department of Human Services. The programs include state-funded income support programs, emergency stabilization, mandated child protective services, foster care, and mandated adult protective services and adult home service care. This year, the board is prioritizing and supporting two major policy priorities that align with the issues that the committee and full council has expressed interest in: multi-generational poverty approaches, and two, families first implementation in the county. I want to speak on supporting the multi-generational poverty approach first. Overall, the board is supporting strategies that prevent generational poverty. We're very pleased that DHS received the Kresge Ecosystem Grant, which is $750K over 3 years, to support further operationalization coordinated service delivery. This grant will provide a project manager and opportunity coaches to assist the East County Opportunity Zone and Thriving Germantown efforts. Focus areas will include early identification, behavioral health, healthcare, and health literacy. Education and Head Start workforce development and self-sufficiency initiatives are coordinated with the Office of Eligibility and Support Services at the community, which also the same office has received the National Association of Counties Award for partnership with Montgomery County, Public Libraries, and the George Heyman Integrates Program, which seniors read to young children in the office lobbies. Just wanted to highlight some of the great work that they're doing. Families First implementation is the second thing I want to speak on as a priority. Congress passed the Families First Act this past year, and state implementation will be occurring throughout fiscal year 19 and 20. Several major changes are impending. The Social Services Officer and Child Welfare Director are involved at the state level, and while the federal government has not released regulations, the Board of Social Services will continue to better understand the changes that are happening with that particular act. For what we know before Families First, the federal 4E funding could only be used for the direct care for children in our home placements. Now, funding can be used for prevention targeting substance abusing parents or those with significant mental health concerns. This funding allows for 12 months of substance abuse or mental health services, preventing potential risk to children. Another major change is that the group homes across the country must use promising, supported and well-supported practices, supported by our research and evidence as determined by the federal government. These are just two of the many changes that will open the door to maximizing funding to help the whole family. Last year, we were very pleased to have gotten briefings from both the Behavioral Health Services and Child Welfare Services regarding substance abuse and the opioid crisis. We know that the behavioral health and child welfare teams are preparing for system changes, and the board will provide input on these system changes throughout. I would also conclude by saying that while our main areas of focus are these two policy priorities, we are also monitoring federal executive and legislative changes. Many of these are considerably impactful on human services access and delivery to the county. We continue to monitor public charge, which has also been spoken about, and you have also made comments on, so I won't go into that in detail. I'll allow our social service leaders speak on that if you have questions. Given our broad range, we will collaborate and communicate with other boards and commissions. As you just saw, Ronna Cook had mentioned us. We're going to work on trying to collaborate and bring all the boards together for screening of resiliency for childhood trauma. So that's one of the things that we want to work towards and try to bring the boards together. Thank you for your time.
Thank you very much for being here and for your presentation. It does strike me that the presentation we just received from the Citizens Advisory Panel for Children, there's an awful lot in common with the work being done by the Montgomery County Board of Social Services. I wonder if those two federal mandates could perhaps be satisfied with a single entity. The other thing I wanted to ask you about the Board of Social Services, a few years back, the Board of Social Services commissioned a report which was, it was a needs analysis and a gap analysis And then also, the Board of Social Services historically has been involved in helping us understand the self-sufficiency standard. Is that work ongoing?
So the self-sufficiency work actually comes out of the Community Action Agency.
My mistake. I misspoke.
And
okay.
so
Thank
the
you.
Board of Social Services, to the degree that they're doing the TANF and they're monitoring the TANF and SNAP program eligibility, there is an overlap again with both workforce as well as with self-sufficiency. So the gap analysis work is sort of iterative and happens in many parts of our department. The key is to bring them all together to see what the overall picture is.
Okay. All right. Thank you again for your presentation. We appreciate your being here.
Thank you very much.
Let's hear from the Asian American Health Initiative.
Morning.
Good morning.
My name is Win Win. I am a chairperson for the Asian American Health Initiative Steering Committees. And first, I would like, on behalf of the steering committee, thank you, Council Member Laventhal and Rice, for the support of the initiative. So the steering committee is a group of 17 professionals and community leaders who really from diverse background who come in with the goal to assist, advise, and also to advocate for the Asian American Health Initiative. So for the fiscal year 2019, the Asian American Health Initiative will continue to focus on the two priorities. First is the behavioral and mental health, and the second is the senior health and wellness. So as you heard from others, commission and board, these two priorities is not new and go across other groups. So I will highlight some of the activities that why this two priority is unique for Asian American communities and what AHI has been doing to focus on these two priorities. So first on the behavioral and mental health issues. So it's easy to be misled by the data out there that Asian American community doesn't have those needs in those because if you look into the multiple study, they show that Asian American doesn't have the need in terms of the mental health and behavioral health. But if you look further into subgroup, the needs are there, especially in the elders, women over 65, and in the teenager group. So the needs is really high, and also there's the gap in the data collection because a lot of time if you look into some the hospital admission data, because of the cultures barriers, a lot of time Asian Americans don't go and seek for help. So it doesn't mean that they don't have the need. So that's underlie the need for us to pay close attention to Asian American health issues, mental health issue, and have an effective way to address this need. So since 2015, Asian American Health Initiative have advanced to continue with the effort, and we focus on in coordinating with other groups to address these issues in Asian American groups. So our approach is to design a lot of educational material we call photo novels. So these are pictures book that highlight that have human face. So
did you bring one?
Sorry, I don't have one handy, but I'm happy
really
to send
nice.
it to you.
I recommend all the boards and commissions check it out. It's really a excellent communications method.
Yes, and actually those photo novels got welcomed by our community, and we translate it to multiple languages so people can relate it, and we have different, every time we translate it, not only just the translation, but also the pictures of people different, so people can relate to themselves when they look at those photo novels.
Have they been disseminated to other communities outside Montgomery County? They're not specific to Montgomery County, and it was a really, original initiative on the part of the AAHI. But nationally, communities could benefit from it.
Yeah, I think Perry can comment more on that. But I think we have submitted this photo novel for the public health to present at other conferences and been recognized, received award for these products. Mm-hmm. So I think this is an example of how Montgomery County can continue to lead the charge on producing well-designed education material, not only for the county, but for other counties as well.
Yep, I agree.
So, and that is the effort that we continue to build on, and also there's other training program in the area of mental health. to help. For example, we train the people on first respond to recognize the sign of mental illness so that they can. It's similar to CPR, but this is designed for mental illness. So when they recognize those signs, they can help to assist those members accordingly. So that's first priority. The second priority is on the senior health, and as the county continue to grow, the population getting age, the Asian American community is one of the large minority group in the county who are with the seniors group. So with that, a lot of time, because of the culture barrier, this group don't seek help, and they need a lot more support in language, and as well as the help them to seek for the social services and healthcare services that the county offer. So AHIs have developed a lot of program in partnership with different senior centers and faith-based organizations. So with that, we get into those senior and help to bring the awareness and also the connection with the center to provide as a resource for the senior community. To conclude that, again, thank you for your support with the conversion of the staff. So now moving forward, we have the full-time staff to joining AHI. That's such a huge support for the program to ensure the service sustained. We are in the recruiting process, and even though it's slow, and we are pushing it forward, and I think with that, it gives us the opportunity to build a strong team to deliver service to our community. And thank you for your support, and I hope that those support continue to carry on, and we will focus on deliver the good service to the community.
Thank you, Dr. Nguyen. Let's hear from the Alcohol and Other Drug Abuse Advisory Council.
Good morning.
Good morning.
Councilmember Leventhal, Councilmember Rice, thank you for the opportunity to address you today. My name is Elise Grossman. I'm the chair of the Montgomery County Alcohol and Other Drug Abuse Advisory Council, AODAC. One of the benefits of going near the end of this whole day today is I've gotten to hear all the other boards and commissions. And when we talked about homelessness, we've talked about children, we've talked about mental health. And one of the underlying threads that goes through all of this are issues of alcohol and substance abuse in our community. And we have a problem with alcohol and substance abuse in our community, both in Maryland and in Montgomery County. And unfortunately, the consequences of this problem are becoming lethal. In 2017, there were over 2,200 alcohol or drug-related intoxication deaths in Maryland. And this is the 7th year in a row that intoxication deaths have increased. And this was a 9% increase from 2016. Of these deaths, 116 occurred in Montgomery County, which is almost double the number of deaths that occurred in 2007. And while the opioid crisis gets a lot of press and it's very important, and many of the deaths are from opioids, 16%, even more are from alcohol, 30%. We know that childhood and early adolescence is a very important time and when people are most likely to begin abusing alcohol and other drugs. In Montgomery County, 2/3 of students have consumed alcohol by the end of the high school and almost 1/3 by 9th grade. Around 1/3 of the county's high school seniors use marijuana, and there's been a sharp spike in vaping and e-cigarettes in middle schools and high schools around the country. Early alcohol and tobacco and drug use has many consequences, from problems in school to an increased risk of contracting an infectious disease, to suffering mental health problems, to overdose to death. We know that drug use at an early age leads to more likely alcohol or drug use at a later age and alcohol use disorder at a later age. It's also connected to sexual assaults, homicides, and suicides. As the Mental Health Advisory Council mentioned, suicides data has become available and is important in our county. In the last 2 years, there have been over 6,200 suicides or self-injury ER visits in our county. Each year, the county spends money on alcohol and drug abuse treatment and prevention programs. But sadly, this is not enough. We know these programs work. For every dollar that's spent on prevention, it saves $10 in long-term saving. And for every dollar that's spent on substance abuse treatment, it saves $7 in the end. We need to continue to fund both prevention, which has historically been underfunded, and treatment in our county. So given all this, AODAC has 2 priorities for the year. First is to continue to advocate for both adequate funding for alcohol and drug prevention and treatment programs in the county and evidence-based laws regulating alcohol and drugs in the county and the state. And secondly, to work with Montgomery County public and private schools to educate not only the students, but the parents and the teachers about alcohol and drugs using an evidence-based curricula. We thank you for all of your support in the past and hope you'll continue to support us as we work forward in the future.
What do you mean when you say evidence-based laws?
There is a lot of research on alcohol and substance abuse, what works in terms of prevention, what works in terms of treatment, and that research isn't always translated into the laws. So for example, we know that the control system that we have in Montgomery County is not unique. There's 17 other states that have this, and that it's effective. It reduces alcohol-related harms, alcohol-related consequences, but there's been research trying to eliminate or privatize this system. So really trying to push for laws that we know that the research and the evidence show work.
Yeah, okay. Okay, I appreciate that. I appreciate that the
AODAC.
AODAAC is really approaching this completely from a public health perspective, which is the way we need to go. In the remaining weeks of this council, this committee will be asked to act on yet another measure to restrict smoking in one of the very few interstices in public spaces where we haven't already banned it. And in general, we're not passing a lot of laws in this area. Criminal justice is all determined at the state level, so the small areas where the county council can influence policy through the making of law, we've already done most of it. I mean, we banned smoking virtually everywhere, right. Not 100% of everywhere, and that's something that we need to think about. I don't think we should, I don't even know if we can absolutely ban the sale of illegal product, so that's another question. But and then the whole system of liquor control, as you know, is caught up in this big discussion about economic development, right. And I'm glad that AODAC wants to weigh in from the public health perspective, because that gets lost. I mean, as one who was a active participant unsuccessfully in the campaign this year, the public health discussion is just completely lost. The restaurateurs dominate the entire discussion. They want easier access to items on their wine list, and it hasn't been about public health at all. And of course, the council doesn't make those laws either. The state legislature makes those laws. But since we have weighed in occasionally, and since the liquor stores are run by the county, people think it's something the county affects. In fact, it's really something the state legislature affects. Mr. Rice.
Well, you mentioned about e-cigarette use, and we've seen a number of studies that talk about how it's rapidly increased and how the ease of which the ability to hide e-cigs with the new technology looking like a flash drive, those are the kinds of things that are incredibly concerning. And so I'm curious as to whether folks have given thought as to addressing, there was a lot of conversations about packaging before when it came to cigarettes and advertising and those kinds of things. And if folks have had those kinds of conversations about things that make it more attractive to teens, right? If it looks like a flash drive, it's kind of a cool thing to do. And so from that perspective, again, just like the Joe Camels of the world, it's like, oh, that's cool. You've got a flash drive and you can actually smoke it. That's awesome. And there are kids who do it just for that, to start and then get hooked on nicotine. And so have there been conversations about looking at those kinds of things as a new direction in terms of where restrictions would be? And just like Councilmember Leventhal said, unfortunately, at the local level, our hands are tied when it comes to these things. Coming from the state legislature, we'd certainly sign on and support, legislation like that, but certainly it's still something at the state. So I'm just curious as to whether or not you guys have given thought to those kinds of things.
Yeah, so the reason we were really thinking about e-cigarettes and vaping is one of the people on our council is a high school student. And she mentioned, this issue of e-cigarettes and vaping is becoming more prevalent. I haven't found data specific for the county. The data I have is nationally. When you talk about tobacco in general, most of the regulation comes from the Master Settlement Agreement, which was a private agreement in 1998, which restricted advertising, labeling, Joe Camel, all of that. Unfortunately, for the most part, e-cigarettes and vaping don't fall under that. And that's sort of become a problem now because we do see advertising towards youth and colorful packages and colorful flavors. And so I know that there are people, I'm not one of them, but who are working on this issue of how do you regulate the advertising of this product. And it sort of becomes a First Amendment issue too of what you can regulate for commercial speech and all of that. But it's definitely a very important issue and something that needs to be addressed.
Yeah, because I remember when it came to, I'm trying to remember now what it was with the flavors, and maybe I was at the state legislature then when we had this conversation, but I mean, it was just around that. And so if the loophole, if you will, or the thing that's now come about is that vaping is taking the place of cigarette use, but the same tactics are employed to target our youth, then we do need to take another look at this. And so it's an incredibly important point that I think that we need to take up with our state legislature. And so, Vivian, when it comes to our next meeting with Melanie and her team, I think we need to make sure that we have something that asks our delegation to look into this issue.
We'd love to work with you further on this issue. And both of you, thank you so much for all of your help with this issue. As you mentioned, it is a public health issue. And I came and testified before the state delegation, and it was me and one other person from public health, and then a whole row of non-public health people with different viewpoints. And all viewpoints are important, but I feel like the public health argument really has to be heard and made.
Yeah, and it's not always clear.
Right.
I mean, you have to weigh the equities. I remember a few years back where Director Alawalia and I were having this very vivid conversation about smoking cigarettes at the Avery Road Treatment Center, where, you know, someone is trying to get off his or her opioid addiction and is relying on a nicotine addiction, and how do you assess the relative, you know, hazards? You know, they may not die of a heroin overdose tomorrow, but they may die of lung cancer 20 years from now. And how do you assess the relative risks and benefits of these different approaches? E-cigarettes, I have a constituent who is frequently making the case to me that we should ease up on e-cigarettes because they provide a transition away from traditional cigarettes. And, you know, that would be for adults. So we obviously don't want anyone to start the nicotine habit to start it, right? So for youth, you don't want youth having access to these products at all. And then what is the role of local government? We've got this bill now that I declined to introduce a few years back. To my knowledge, there is a constituent who has been petitioning us to prohibit smoking in outdoor patios in restaurants, because we've already prohibited in restaurants. And back 15 years ago when we did that, the compromise was if you have an outdoor patio where people know that they can smoke, you can continue to smoke there. And there's a resident of Rockville who persuaded the Rockville City Council to clamp down on that and has now persuaded Councilman Katz to introduce that. And I have very mixed feelings about that. I mean, there remain nicotine addicts. That's a fact. And nicotine is legally available for sale, and people get addicted to it. And people get addicted to caffeine, too. And I don't really even know. I'd love to see some information about the relative risks of nicotine versus caffeine. You know, I had a cup of coffee today because it was available. I've stopped drinking coffee, but it's bad for my blood pressure. And I have to go to the bathroom too often, you know. So I've pretty much stopped. I pretty much stopped caffeine on doctor's advice. I mean, I'm down to 1 or 2 cups of coffee a week. And what is the relative risk to my health of nicotine versus caffeine? I don't know the answer to that. I mean, caffeine, if I went to sleep late and I had to wake up early, like last night, you know, a little caffeine makes me alert. I'm not proud of it, but it's a chemical dependency. Yeah. It makes me alert and, you know, awake. Well, nicotine does that too. I've never been addicted to nicotine, so I can personally describe the effects of caffeine. I can't personally describe the effects of nicotine. How would you compare those things? I mean, I'm at an age where caffeine is a problem for me. It's a problem for my blood pressure. I have chronic hypertension. I take medication for it. It's under control. But, you know, so I've been warned about caffeine. But nobody's talking about caffeine. And I'm not suggesting that caffeine ought to be a focus for AODAC, except how do you compare it to nicotine? I don't know the answer. I'd be interested to know about that. So, you know, cannabis, right? Oh, my God, huge conversation there. I mean, cannabis is coming. Legal cannabis will be here one way or the other, whether whoever wins this gubernatorial election, the state of Colorado is now getting $1 billion in revenue from the sale of legal cannabis. Okay, huge policy issues. We haven't even begun as a society to think through this, and yet, you know, criminalizing and and prohibition of cannabis is unsuccessful, and it leads to all kinds of unjust effects, and getting back to the equity discussion, all kinds of sentencing disparities, and ruined lives of people who have really not harmed anybody by the consumption or sale of cannabis. So we need to really look at those issues, but it's not simple. I mean, they're not cut and dried yes or no questions. People are going to have chemical dependency. They're going to have it. I mean, we're not going to ban all consumption of all addictive chemicals. We're not going to ban consumption of nicotine or caffeine, and we're probably going to liberalize consumption of cannabis, which is arguably addictive. Some say it is, some say it isn't. So anyway, we have to take we have to look at these issues through a very sophisticated lens. I don't think the answers are cut and dried in any of these questions.
I agree. I don't think the answers are in regards to cannabis. I think the role that you all play is that it's important that as it comes, since it does seem that it's coming down the pipeline, that we learn from alcohol, that we learn from tobacco, and that we know what works and specifically what doesn't work with both of those substances. And in many cases, it's sort of this blanket legalize cannabis without putting the proper things in place to prevent youth from getting access, from prevent advertising to youth, from prevent edible packages that look just like non-marijuana edibles. And that's really where the role of the county council, the state, all of them play a role to make sure that if it gets legalized, it does so in a way that we've learned from the past.
Yeah, I think we also need we need a lot more research. We need a lot more evidence. We need to know a lot more about substitution effects. Mm-hmm. Legal cannabis is being promoted as an alternative to opioid addiction. The evidence is unclear. Maybe it is, maybe it isn't. Alcohol is much more toxic and leads to, violence and other social breakdown at a much higher rate than cannabis does. I say that just from, personal and anecdotal knowledge of, what alcohol can do to families. But there's not a lot of evidence here. So when you say we know what works with alcohol, that doesn't mean we've fixed it.
No, we know it doesn't work too, and there's a lot of discussion there, but we need to at least learn from it and try to use what works and what doesn't work and what we're not sure about to guide cannabis laws. And then a last plug, you mentioned Avery Road, the groundbreaking ceremony, I believe is next Monday, and hopefully you both are coming.
Planning
on it. Because we're really excited and all the work that's going on.
Very excited, and this committee has been a strong supporter of the new facility. Okay, well, thanks for a good conversation.
Thank you.
Thank you all so much for your service to Montgomery County. We have one more? What now? Oh, the African American Health Program. Okay, they were not in the packet. Yep. I would never forget the African American Health Program.
It's still morning. First, I want to say thank you to Councilmember Leventhal. We're going to miss you. We thank you for all your hard work, but we thank both of you for your support of Health and Human Services, and specifically, since I can be personal, the African American Health Program, and also to Councilmember Berliner. I want to just say the executive committee, we are volunteers, and there's a core group of us, it's about 6 of us, and then we have co-chairs who mirror the primary focus areas that are the areas that we deliver our services for, and that is cancer, cardiovascular, diabetes, HIV/AIDS, STI, infant mortality, and oral health. We use mental health as a cross-cutting service because it crosses all of those different focus areas. We also have added some specific subcommittees to address aging, youth and young adults, and Black males' health and wellness. When we look at the climate of today, we see a lot of stuff going on, like voter suppression, attack on women's rights, attack on the ACA, and specifically possibly the elimination of the pre-existing conditions. And we look like history is repeating itself. That causes us to pause, but also we want to stay awoke. So when we were reading the recent equity report from the Office of Legislative Oversight, we were kind of intrigued with it. According to the Office of the Legislative Oversight, or OLO, report, the Racial Equity Institute reported, and I quote, that nationally, people of color experience significant disadvantages in education, economic stability, health, life expectancy, and rates of incarceration. Nothing new, I think we know that, but they did put it out there. The OLO report further cites that and I quote, the Government Alliance for Race and Equity, which you alluded to earlier, which is GAR, finds that those seeking to eliminate racial disparities must focus explicitly on race, have regular conversations about race, and establish new behaviors that diminish racial disparities. The county just came out earlier in the year with the surveillance report on population health. And again, it talks about, I think Councilmember Rice talked about the fact that non-Hispanic blacks, we have higher death rates when you look at mortality, and non-Hispanic blacks have higher morbidity rates. So what does that have to do with the African American Health Program? Everything. All of these things that I just mentioned. We applaud the county for continuing to fund the African American Health Program, which is a county program, which has been tackling racial disparities since 1999 and has been working to eliminate the many health disparities that plague our target population, which is blacks and people of African descent. Our goal is to continue to do this. Our program manager recently reported that AHP's current priority focus areas provide targeted services that address 4 of the leading causes of death, which was reported in 2014 and 2016. We wanted to also showcase our successes that we've had. 90% of the participants who are enrolled in AHP with elevated blood pressure, like you talked about, you need to come to our program, maybe we can help you out.
I'm doing good. No, I take meds every day. It's under control.
Have shown improvement over 3 to 6 months. 100% of the participants enrolled had improved A1C levels at 3 months follow-up, and 100% of the participants learned to better monitor their blood pressure. In 2015, it was reported that black infants died at a rate of 11.9 versus 2.4 white infants. I want to go, and this is, we address infant mortality through our SMILE program, which is Start More Infants Living Equally Healthy. The Interagency Commission on Homeless, they talked about the high number of black homeless people, where in AHP we're seeing an increase in black pregnant homeless women. And so that is a trend that we probably need to look at and focus, because what happens with the homeless population, that comes with we need to coordinate that with other services in the county like mental health and housing and things like that. HIV/AIDS has been a priority area for AHP since 2000, and we've been specifically focusing on STD and STI. We're excited that public health is looking at that STIs, which we also have seen that trend of increasing within the community. We also have been making strides in mental health. There's 201 residents have used the online mental health screening tool, which you can view on AHP's website, and access rather. 105 residents who were enrolled in AHP's chronic disease and management classes were screened for mental health using the Patient Health Questionnaire 9. 188 females who were enrolled in SMILE were screened with the Edinburgh postnatal depression tool. Our hope is that the county will take steps, as stated in the OLO report, to 1, develop policies that address racial equity and not be colorblind to the problems. Be proud of our diversity, but don't let the strides that have been made overshadow racial equity. And maintain our inclusive outreach and public engagement strategies and practices like the one we're participating in today. We recommend that the county's priorities next year should include the implementation of the suggestions in the OLO report, and we'll be watching that because we want to have a seat at that table. And use the data from the surveillance report and the recent hotspot zip code data to address racial disparities, specifically those in health. We feel that by focusing on these priorities, the county will experience a reduction in premature deaths and the rising health care costs, as well as a reduction in the social, societal factors associated with poor physical and mental health, chronic diseases, and health disparities. We hope that the county will keep programs that focus on minority health, their uniqueness, and strategic focus, like the African American Health Program and those of our counterparts, intact. However, there's not a one-size-fits-all approach, and it does require much coordination and collaboration. We want to thank you all for allowing the African American Health Program to continue its focus. We'll still be there advocating for it and its mission and its resources.
Great.
Thank you.
Thank you so much. Thank you for your leadership as chair, and I know you're rotating into a different position, but you've been an extraordinary advocate. And there are many leadership organizations in this county, as there should be, because it's a big and diverse community, that represent the African American community. I think the African American Health Program is fortunately situated to make a very strong argument to policymakers. You're grounded in evidence, you have staff, you have the capability to back up your assertions with data, which policymakers are hungry for. A little data can go a long way with elected officials because our schedules are so crazy and we're pulled in so many directions that we don't have the time to do independent research ourselves, so we're dependent on our staff. And when community advocates come with data, it makes a big difference. So the AHP has consistently done that. And then the question, and so now we're in a very fortuitous moment because Dr. Gales is really getting heavily involved in a very significant way in a data-grounded analysis, which is what the AAHP has been asking for over a long period of time. So, we've talked about this privately, Pat, but I'll just say publicly, I think it's very important that all the minority health initiatives are integrally involved in the public health effort to assess where the hotspots are, where we need to target our interventions, because what you come away with in a meeting like this morning is we need to intervene everywhere and we need to spend more on everything and everything is urgent. And all those things are true. And yet government doesn't have unlimited resources, and so somehow there has to be some way to rank and prioritize. There has to be. And so the public health effort, I hope in the future, will be even more closely linked with the minority health disparities efforts. And this discussion, and I don't need to repeat what I said earlier to the Latino Health Steering Committee, but this discussion about equity, it is urgent that the representatives of the affected communities watch that very, very closely. You don't want to delegate a discussion about equity to policymakers who, as I said earlier, I'm sorry to repeat myself, are on the fortunate end of the wealth distribution gap, and resource distribution gap. So it really, that's going to be, it could be such a great discussion for this county, or it could be a big waste of time. I don't know which way it will go.
But we're interested.
And that depends on the community advocates. That depends on community advocates holding county government accountable for its promises. Mr. Rice.
Yeah, and I think that look, when it comes down to what our minority health initiatives as a whole are trying to do, it was captured this past Saturday. I was at Living Word World International Christian Church, who was doing a health expo, and AHP was there. I think AHI and LHI were there, but we had community partners that were across the board promoting health for the general community. And so making sure that we have folks that are there that are reminding people about the urgency of how those disparities affect those who certainly need the most assistance, who aren't as connected as or as fortunate as the chair said. I mean, we've got to continue to remind folks of who we are in Montgomery County. We oftentimes get lost in the fact that, yes, we have members of our African American community, members of our Latino community, members of our Asian American community who are very well-to-do and very well connected and have access to the things that they need. And so therefore we kind of get guided by that and thinking that there aren't, or the disparities aren't as great as they truly are. The reality is that creates an even larger exacerbation of those issues. Because of that, it's not just the fact that we have wealth here in Montgomery County for some, but also that we have wealth in those very communities that also make it seem as though that issue is very small, when in reality it's very high, because what happens is the availability of services for those who need it the most isn't a focal point. And that's where each of these individual entities comes in to make sure that we highlight that for those, because as the chair said again, which I completely agree with, they don't have time to be here. They don't have time to show up at the public hearing. Because if I have to work 2 jobs to take care of my family and put food on the table, if I'm making a decision about whether I'm paying for, the light bill or paying for my child to get a mental health screening or to meet with a therapist, I don't have time to then come here and tell you about it. I have to try and fight for what I need to. And so it really is important that we take it to the streets. Luis and I talk about this a lot when it comes to, if you want to make sure that a person who's at risk of gang affiliation and you have a teen town hall and you say, look, come here and talk about your issues and tell me what's wrong. I'm sorry, they're not showing up here. The kids that are showing up here on Wednesday are the kids who are going to college and have 2 parents at home those are the kids who are coming here, right? So we have to take it to the streets. And that's what you guys do. You take it to the streets, you're out there involved in the communities, trying to meet them where they are. That's where the rubber meets the road and where these things happen. And so for all of you, it's not just AHP, but for all of you who do that, that's the important part of this work, right? And getting those voices and representing them to us, right? We try and do our best job of getting out there. Like I said, I was at Living World Church, but I promise you there were 20 other events that happened on Saturday also. I know because I was at, Pat, I was at yours too, so I was bouncing around between them. And so there were 18 more, right, that were happening. And so that's why we need your voices to be out there. That's why it's so important that you're outreaching to the community and getting that so that you can bring that back to us so that we can make sound decisions. Thank you, Mr. Chair.
And one of the events that happened this weekend was put on by Dr. Gales and his team, and it was titled Envisioning Equity in Montgomery County Using Data. And I just forwarded to you, Pat, as we discussed the information about that. But this will be the last time that I will host this convocation of boards and commissions as chair of the HHS committee. I've gotten a lot out of it today and over the years. I do think it's useful for us all to get together and, as others had said, learn from each other. This is an extraordinary county blessed with great resources, a great body politic, a public that supports experimentation in public policy. We've been able to achieve a lot, from the creation of the minority health initiatives to the establishment of the Montgomery Cares Advisory Committee to the effort to end veterans homelessness, and we're nearly ending chronic homelessness. We couldn't do these things if the public didn't believe in an active and vigorous government that really meets people's needs. So thank you all for the role that you play in participating in the policy making. I've always and even in my comments today, I would like to see these boards and commissions even more effective and productive than they already are. I think there's a range, and that's to be expected when you have a lot of them. But I do encourage all of the residents who participate in these to continue your work, redouble your effort. We do this work because we care. We want to help people. We want to improve the quality of the lives of community members. And so I deeply appreciate your contributions, and it's been a great privilege to work with you over the last 16 years. Mr. Rice.
So, Mr. Chair, I just wanted to take a moment of personal privilege to thank you. And I want to tell you that, you know, when I first got assigned to Health and Human Services, I was a little unsure of what I was walking into. I knew that I wanted to be on education, and when I got assigned this committee, I wasn't aware of a lot of the breadth of the topics that we discussed and the impacts on people. And I can't tell you that I've met another person who isn't committed as much as you are to ensuring that when it comes to the health and well-being of our Montgomery County residents, you are just top-notch. I've learned so much from you. And you highlighted about homelessness, you know, and it's one of the things where, again, I mean, who doesn't care about homelessness? Everybody cares about it. But to do the things that you've done, to be a leader in this role, it just says a lot about you, it says a lot about your character, and it says a lot about who elected officials should be. People who roll up their sleeves and do the work and give a damn about their community. So regardless of what you see at the federal level, elected office is still a noble one and still well and alive because of people like George Leventhal. So I just want to thank you, sir.
Thank you all very much.